today we're going to talk about ways to increase thoracic mobility. This particular exercise or stretch goes over thoracic extension, as thoracic immobility problems can create problems with shoulders. So if you have a chair or a bench or even the side of your bed, what you want to do is kneel in front of it and then put your elbows or triceps muscles on the edge of the bed or chair, and then try to drop your chest, head, and neck down through your shoulders to increase your thoracic extension. And you should feel a nice stretch through the lat muscles and through the thoracic spine. And that's something you can hold for anywhere from 30 seconds to a minute at a time. Today we're going to talk about how to increase thoracic rotation when people have thoracic mobility problems. So starting out in the seated position, you want to roll down to your back, keep your knees bent, and then you want to rotate your hips and pelvis to your side so that your knees and hips are stacked and your shoulders are stacked one over the other. And make sure your head and neck is in a relaxed position. If you need a pillow, you can grab one. And then what you want to do to increase your thoracic rotation or check your thoracic rotation is bring your arm back as far as you can to the ground or floor. Now ideally you should be able to come back to the ground or floor, but sometimes you can't. So sometimes you may be able to get to here or there, and that's fine. So you continue to work through whatever your comfort zone or safe range of motion is until you can get all the way down to the floor. Also keep in mind that sometimes people with certain arthritic conditions in the thoracic spine will never be able to get all the way to the floor, but this helps them maintain the good thoracic mobility, rotationally speaking, that they do have. So I'm going to show you on the other side. Once again, stack your hips and your knees together, arms and shoulders stacked, and then rotate back to the side. Now you can do this in repetitions, or you can just simply hold that thoracic rotation for 30 seconds to a minute. Today we're going to talk about different ways to increase your cervical spine mobility. Everybody knows that you can stretch your neck from side to side, rotate right and left in order to increase and stretch mobility. But we're going to go over some different traction devices that you can use to help increase cervical spine mobility. What we have here is called a posture pump, okay? And I like this device from the standpoint of it helps increase cervical spine mobility while also trying to create a curve within the neck of the spine. How you use this is you want to lay down on your back and pull the harness down to your shoulders, and then you simply strap your head in. And then using some regular blood pressure cuff that it comes with, you just pump it up to whatever level is comfortable to you. Now, keep in mind that you want to keep your hips and lower back level and keep your knees bent to take stress off your lower back while you're doing this. And you just lay here. And this can take from anywhere to 20 minutes to 30 to 45 minutes a day. And then once you're done, you simply just release the air, unstrap your head, and sit up. But it's important to remember that if you are choosing to use one of these devices, consult a chiropractic physician first to make sure we know this is the device you need to be using to help increase your cervical spine mobility. Another device that you can use to increase cervical spine mobility is this vertical traction device. for the neck. These are relatively inexpensive, and I like to usually start here first when I think a patient may need some type of cervical traction. So just place over your head, and there are 2 straps, or Velcro straps. You just want to Velcro them down. And then once you have it in place, it comes with the regular blood pressure cuff pump. And you simply just pump up. Traction device. It does take some time. And you basically pump it up to whatever you can tolerate from a traction standpoint. I usually like to tell people to pump it up to the point where they feel like their head is floating on their neck, so you don't feel any stress in the neck region. And so I like these devices just because if you are at work or at home doing work, you can still be mobile and functional and still do things while using this and still getting some type of therapy at the same time. This is something, once again, you can do for 20 to 30 minutes at a time. And when you're done, simply just use the release valve to let the air out and unstrap yourself. Once again, before using this device, you want to make sure you consult a chiropractic physician to make sure it's appropriate for you.